Guku thirikari igitanya gukuruhianite njanjo kuri andu milioni 10 tugikinyaniria muthiaini wa mwaka uyu. Mihang'o ya gutigirira undu uyu ni wakinyanira nithiete gikiro-ini kingi thutha wa thirikari gukuruhania ruhonge rwa kambuni cia andu kiumbe mihang'o-ini ino. Kuringana na mutafariri wa Mihang'o ministry-ini ugima wa mwiri ndagitari Mwangangi augite gukurania KEPSA ni njira imwe ya gutigirira Kenya ituri-ini ciothe cia bururi ni mahota kwamukira njanjo gutari na mihingo yothe.
We are especially happy because this partnership has seen the realization of us having the J&J platform in the country. And what is even more exciting is that this J&J has been availed through public resourcing. Resources from Exchequer together with resources from the private sector have made this possible.
Mwena-ini wake murugamiriri munene wa ruhonge rwa KEPSA Kariuki ni agathiriirie ikinya ria thirikari akiuga undu uyu ni ukuhura njeki mihang'o ya thirikari ya gukinyira mundu wothe.
Private sector decided to come and support government in two ways. One, to see what we can do, be it financially.
How can we speed up vaccination in the country? Because when we look at the data, and I know that Kameme will be sharing a little bit about that, is that where there's been increased vaccination, the economies are rebounding much easier, much better.
Ihinda-ini o riu atumia aria mohete nda ni moritio kwiyumiria kwa wingi niguo makorwo makiheo njanjo ino kuona aingi ao mahota gukorwo mari ugwati-ini munene.
Getting patients who are younger and women who are pregnant getting COVID, and a number losing their lives around the age of 30 to 40. So that's why the vaccination scheduling was changed, so that women who are pregnant are now also included in those who should get vaccination, because it's safer for them to be vaccinated.
Na itajira ya gutigirira gutire mundu wa hatukwo ni uheani wa njanjo ino guku bururi-ini. Thirikari ni yugite arithia guthama onao ni magukorwo makiamukira njanjo muthemba wa Johnson & Johnson kuona ithecanagwo rita rimwe tu.
We've had requests, and this is why I was saying we're still trying to map out how we move J&J, because some of the requests from some of these counties are that they require J&J more compared to other doses because of their migrant communities or populations. Because also, an interesting fact, J&J, out of all these vaccines, is able to be refrozen.
Gukinyaniria na riu andu makiria ma milioni 3 nio mamukirite njanjo ya mbere na ya keri ya murimu wa COVID-19 guku bururi-ini. Umuthi andu 446 nio manyitikanite na murimu wa COVID-19. Ithabu ria arwaru bururi-ini rikirugamira andu 248 826. Gikiro kia ugwatania ikirugamira gicunjini kia 7 hari igana andu 459 makihona. Ithabu ria andu othe mahonete ari andu 235 igana rimwe ria 96 arwaru 21 magikua na namba ya andu othe makuite guku bururi-ini ikirugamira andu 4,949. Ngiribotera Kameme TV, ritwa rakwa ni Wanjiru wa Foro.